L4, L5, L5, S1 disc bulge. Is this something you're dealing with or diagnosed with? Well, stick around because in today's video, we're going to give you some tips on how to deal with this at home and avoid surgery. Hi everyone, thank you so much for tuning in. My name is Dr. Vincenzo Romualdi. I am a chiropractor in Yorkville in downtown Toronto. And today we're going to be discussing L4, L5, L5, S1 disc bulge and some tips on how to avoid surgery and deal with this at home. Now, before we get into today's video, I'd just like to say that chiropractic care can help with conditions such as disc bulges, but what I'm after is making sure that you are functioning optimally always. So if you have a stress in your life, whether that stress be a physical, chemical, or emotional stress, you're dealing with it at your best because your body is functioning at its best. It's my sole objective, comes right from the heart. Now that that's said, let's get into today's video. So L4, L5, L5, S1 disc bulge. What is it? Well, there are other names for it, such as disc herniation, and in very severe cases, disc ruptures. Now, in terms of disc ruptures, there is a small chance that you might require surgery, but that's very, very rare. Today's video, we're going to be discussing disc bulges and disc herniations. If that is what you've been diagnosed with, well, this video is for you. So, what is an L4, L5, L5, S1 disc herniation? Well, the L4 and L5 and L5 S1 is referring to the levels of your spine. L4 and L5 are the last two vertebrae of your lumbar spine or your low back, and S1 is where your sacrum starts, and L5, S1, L4, L5 are where the nerve roots are leaving your spine, where the discs are. So let's show you what that looks like. So if this was your L4 and L5, these would be your vertebral bodies here, these white bony bits, and in between we have the cartilaginous disc that is, as you can see, nice and healthy and big. There is no protrusion here at the back impeding on the nerve, which is what a disc bulge or disc herniation would look like. So in this model, there is a disc bulge or disc herniation right at the posterior lateral aspect of the disc here. And sometimes this can present with pain, numbness, and tingling down the leg. If it does not, it's because it's not impinging on the nerve just yet or at all. So if it is impinging on the nerve, that could potentially cause you pain, numbness, and tingling down the distribution of this nerve root. So this disc bulge is out to the left. These disc bulges can be created out to the left, out to the right, or back centrally, and is typically caused from compression and flexion of the spine coupled with a movement such as rotation. So here's another model. Again, here are the two vertebrae, the disc, and as you can see from the top here, we have your nucleus pulposus, which is this red-orange bit. Now, typically the nucleus pulposus is supposed to be in the middle of the disc and remain there. As you can see here, it's seeping out into the disc and into the disc space because the annulus fibers of the cartilaginous disc have been torn or ruptured, and now the nucleus pulposus is seeping out of the middle and into the disc space, impinging the nerve, potentially causing you pain down the distribution of that nerve. So how can you deal with this at home to avoid surgery? Well, there's three things in this video that we're going to be focusing on. The first thing is decompression of the spine, because like I mentioned before, disc herniations are caused from compression, too much compression of the spine. The second thing we're going to be focusing on is making sure we're centralizing that disc herniation or disc bulge. And the last one is extension, because extension will help to promote the retraction of that nucleus pulposus back into the middle of the disc where it should be. So this first exercise that we're going to be doing is to decompress the spine, is simply to be hanging from a bar or simply hanging from anything you could find to hang from. I'd recommend a pull-up bar. If you cannot find something to hang from, I'm going to be making another video where we're going to be going over some tips on how to decompress the spine without a pull-up bar at home. So be sure to stick around for next video if that is something that you need. Now, in terms of hanging from a bar, what we're going to be doing and focusing on is decompressing the spine by hanging, but you want to be making sure that you're not engaging your hip flexors because this will promote flexion in the spine, which is what caused a disc herniation in the first place. So to avoid doing that, what you could simply do is hang from the bar and just make sure your feet are gently brushing the ground, which will keep you from engaging your hip flexors. So this is how you can decompress your spine. Second thing is how to centralize that disc. Now, if you have a lean, this second tip is for you. If you are not leaning to one side, then skip right to step 3. Now, the reason you might be leaning is because when a disc herniation occurs, it can occur laterally, which is right or left. If it does occur to, let's say, the right, the disc is bulging to the right, you'd be leaning to your left, away from the bulge, away from the pain. So what we want to be doing is centralizing that disc bulge, and a simple way to do that, you lean up against the wall in the direction you're already leaning, and then as you're leaning on the wall using it as support, you bring your pelvis under your spine. So making sure you're helping to centralize that disc herniation. This should not cause any pain. If it does cause pain, don't do it or come just off of it. So this will help to, again, centralize that disc herniation and prepare you for the extension exercises. Now the third exercise is going to be this extension exercise. Now there's different names for it. The one I'm going to be showing you is the McKenzie exercise, and this will promote extension in the low back and help to retract that nucleus pulposus back into the middle. The key thing here is to do it gradually and make sure you're avoiding anything that triggers your pain or symptoms. We don't want to be causing pain, we want to be improving function. So in order to do that, what we're going to be doing is starting on our tummy, and you could simply start by lifting your chin and neck and seeing how that feels. If that feels okay, then pushing your hands up and extending your arms and doing this very slowly and gradually, and making sure that your hips are in constant contact with the floor or the table. You don't want to be lifting your hips because that will not be promoting the extension that we're trying to achieve here. So hold this for 30 seconds wherever you are comfortable holding it, and trying to progress day by day. You want to be repeating it 3 times. So those are 3 tips on how to make sure that you're avoiding surgery and dealing with a disc herniation or disc bulge at home. Again, those 3 tips are decompression of the spine, making sure we're centralizing that disc bulge, and extension to get the nucleus pulposus back into the middle of the disc. Thanks for tuning in. If you found today's video helpful, make sure to share and like this video. Comment below with any questions or any future suggestions for future videos. Thank you again for tuning in. My name is Dr. Vincenzo Romualdi. Have a nice day.